Cancer, diabetes, obesity, hypertension, and asthma are all examples of non-communicable diseases, and sadly, these diseases are the leading cause of death globally. But do they really affect us here in Africa? And are Africans really living with these diseases? Find out here at the African NCD Champions podcast as we share incredible stories of Africans living with non-communicable diseases. My name is Ogweno Stephen and I'll be your host. Let's roll.
Right. Thank you very much for agreeing to come on the podcast today.
Thank you.
And again, we're talking about NCDs, COVID-19, and our experiences during the pandemic, but also the lessons that we learned.
Yeah.
But before we get into the details of all of that, let us do a bit of an introduction. So give us an introduction to yourself. Who are you? What do you do? And all of that.
Okay, thank you, Stephen. My name is Moses Omondi. I'm a cancer survivor, specifically bone cancer. It's a rare type of cancer. I'm a volunteer. I can say I'm a man of many hats. I'm a volunteer. I do sports, that is amputee football. I do graphics. So, but my main passion is around NCDs, because I can say that NCDs now, that's my family. Because after being diagnosed, they accommodated me, and now I started my new journey as a person living with non-communicable diseases. So I was diagnosed back in 2014. I was still in high school, still a young boy. So I was confused at first. I didn't know what was going on. I started experiencing like small pain around the knee joint, my right leg now. So I went back home one day and told my parents like, hey, niko na kauchungu, I don't know what's going on. And they told me, we know you boys, you like playing football, maybe you got an injury. So just take a warm water and rub, na utakuwa poa. So I did that the first day. I went back to school. The second day, it wasn't going away. So as time went by, now the pain was becoming like now massive. So I told them like, this thing is not going away. And they told me, I will check, don't know what that is, but maybe take some painkillers. So one day when I was on a parade, I fainted. And then my dad was called to school, and because already he had an idea what was happening, he took me to Nema Hospital. We went there, we did some x-ray, but the doctor there saw the x-ray and told us that this is something, we don't know what about it. We'll refer you to to Kiambu. Go to Kiambu, maybe you'll see a doctor there and he'll explain. So we went back home. The next day we went to Kiambu Hospital. Just on seeing the x-ray, the doctor wrote a referral letter and told us, go to Kenyatta. This is beyond us. We went to Kenyatta. Back then there were a lot of stuff that was going on around the country with accidents. Maybe a building has collapsed. So there was a lot of line. Casualties come on Monday, like that for like almost a month. And then sema kibati mzuri, we got a bed, and now the swelling was big because each and every day ilikuwa inafura, the swelling inaongezeka. Yeah. So when we got a bed, the doctor told us that like we can't say actually what is going on, because these x-rays, they were taken some few months ago. So we need to do like a biopsy to determine what's going on. So I went for like a minor surgery, and a biopsy test was done. So we were told like this will take like almost a month plus for you to get the results. So instead of you staying in the hospital and the bill piling, we'll just discharge you, go back home, and then you'll come back when the results are out. So we waited for almost a month plus, and eventually the results were out. We were called, and we were in the doctor's office. He told my dad like, we've seen something. It was like a tumor at first, but now this is, they called it's osteosarcoma. It's a rare type of cancer. It's a bone cancer, and where it has reached the only solution is amputation, because now the swelling was big, the size of my head big. So we were told the only solution here is amputation, because where it has reached, we can't save the leg. So for us to save his life, he'll have to go through amputation. On hearing that, I just went out. I was emotional. You're still a young boy questioning, why, God, why me at this point? And by then, I had nilikuwa najua, like, if you have cancer, that's it. That's the end. You're out. So on hearing that, like, wow, we went back home. Like, my family, my mother, dad started giving me some talk, like, just encouraging me, just go through it. It's not the end of life, you know. So it reached a point where now the swelling was, it reached a point where you feel it going in and out. And then the doctor told us, you need to be readmitted because this is not good. And if it continues like this thing will burst. And if it bursts, that's the end. So we went back to the hospital, and now my blood pH was low. So I had to be donated some blood, but now the swelling was sucking the blood in the body. Even if they donate, they add, still nothing. So the doctor told us that for what we'll do, we'll take that blood with you to theater, and when we operate with you, we'll just now be adding you blood, because if we do it this way, that swelling is just continuous. Yeah. So I went in on 7th of 7th, 2014. I was amputated, and so when the swelling was around the knee joint, but it was moved up the thigh, just to make sure that the cells has just spread to the other part of the body. So I went through operation. I stayed in the hospital for like another month, and then I was discharged. So when I was discharged, I was told you need to come here for like chemotherapy and radiotherapy, just to confirm
that it's truly out.
Yeah. And for that, by then NHIF wasn't paying outpatient services. So we had to pay like 3 weeks. We had to have like 10,000 shillings for those services. It was a burden to the family. We had spent like each and every coin that the family had, because my mom was just an house help, my dad was doing carpentry and that. So it was a burden. So we decided, like, we went for the first session, but after that, my mom and my dad, we sat down and we said, like, this is too much for us. If the operation was successful and everything, let's just believe that it's gone.
It's gone.
Yeah. So I stayed for like that whole year, and then I went back to school. I was in Form 2 by then, so I was supposed to go to Form 3. So I had already lost a year, so I went back. When going back, I was ready to repeat, but the head teacher told me that you're a bright student, and with this new journey that you've started with your friends, they were coming to visit you and everything, you can't repeat because you'll feel lonely. They were with you, you need to go like together and finish. So you just go, continue, and if you fail, you'll come back and you'll repeat and you'll take care of everything. So I continued to Form 4, and I finished back in 2015. And since then, I haven't experienced anything. I can say it's been 8 wonderful years of a new journey and a new life. Yeah.
Interesting. And it's a risk that your parents took with not going through, and it was like, nothing is happening. We are good. Nothing is happening, we are good, until, 7-8 years later, like, it went well.
Yeah, it was a risk, but there's a time I went back to the same doctor and I asked him, and he told me that for you, like, operation was the major thing. So for this other chemotherapy and radiotherapy was just for confirmation. But where we amputated you, it was way above the affected area. So that was just for confirmation.
So it was less likely that it would have spread anywhere.
Yeah, true.
I see. All right. So during COVID-19 period, that was a tough one for everyone. So what was the experience like now as an amputee and having gone through bone cancer? Oh, and we actually hosted in the past another bone cancer survivor who actually got the diagnosis very early and sort of was able to save up the leg now. Yeah. So for yourself, now that COVID-19 came and we were being told, hey, if you have this disease, you are done. Don't even come out. What was the experience like, and how did that look like?
Okay, when COVID came, I can say it was scary first on hearing that people with these underlying conditions were at risk. But I can say it was like a moment and a time for us as persons living with NCDs just to reflect and to appreciate life. Like now we had a whole year just to reflect, just to have your own time to check on yourself, just having yourself, your time, taking care of your mental health. But it was scary for us because as for me, I can say I was lucky. I got my treatment way back before COVID-19. But I had friends who were going through that during the COVID-19 era. They had their clinics, their medication. So having those curfews and lockdowns, like it was hard for them even moving from one point to another, just going for medication. We even lost a friend because of that. He was unable to access his medication. And I can say as a country, like when something comes up, we focus on that and neglect the other. We were focusing on COVID-19
and we dropped everything
else. We were forgetting that for us, NCDs are our pandemic, our daily pandemic. But we are focusing on this one that has knocked on our door, forgetting on the other one that was already in the house. So it was a tough time for us as a country, as persons with NCDs. Like it was really tough. Yeah.
And what would you say are some of the learnings that we learned past the pandemic? Did we learn anything? And if we learned something, what would you say that we picked up from COVID-19 as a lesson, especially in terms of taking care of us as people living with NCDs?
Okay, I can say we learned as a country, be it positive or negative. First, on the positive side, I can say that we were prepared. After COVID came and we had our first case, now the government took out the measures and started having the measures to curb the spread of the virus. But another thing is, as a country, we wait until it's here for us to take action. We should have those programs, or what do we call them?
Like emergency
preparations. Like have just that a committee before. As for COVID-19, I can say for us it was like a first thing. It was new, so we should learn from that. Let's prepare for pandemics, for emergencies. But as a country, we've been having droughts and that, so it's not that new for us to have pandemics or droughts or floods. So we should prepare before, instead of us waiting until it's here
and then
reacting to it. We tend to make more mistakes instead of solving the problem.
Yeah. So final lesson, key takeaways. What are your what do you want the people to learn, like general normal day guy? What do you want them to learn about NCDs or cancer, for example, and COVID-19, and even taking care of people, for example?
Okay, I have to take home notes, two key notes. First, I want to say that NCDs, people should know the difference between communicable and non-communicable disease. For the general public, they tend to like generalize everything. These are all communicable disease. So when they see a person with an NCD like cancer or diabetes, they're scared of you the way they're scared of someone with TB or HIV. So they should get the difference between communicable and uncommunicable. These are two different diseases. And for an NCD, we are one community. The moment you are diagnosed or you identify as a person living with an NCD, you are under that umbrella now. That name will stick with you for the rest of your life. So we should learn to accommodate one another, love one another, and just take care of your brother. Because we are under one umbrella. This is me having cancer, there's someone with diabetes, but there's no difference. We all have these NCDs. So we should fight for the same goal. And another thing, second point I can say is to the government, like, invest to protect. Invest in health, invest, like, let's have more funds towards NCDs, because a healthy nation, you can say a healthy people is a healthy nation. Without these people, there's no government. So just take care of NCDs. We should have more funding, because if you have more funding, we'll have more personnel and more medicine. Instead of, when I have cancer, I'm more worried about my finances, how I'll pay the bill, instead of how I'm going to get treatment. But the moment when the government just channels funds to health, if I am going through a treatment, my mind, like, it's just free. I'm at ease, just thinking it's only treatment. My bill, my everything is taken care of. We should be like the way they have done with HIV. If you get an HIV infection now, from treatment, diagnosis, and everything, it's taken care of. That's why nowadays even you see there's less stigma, because there's more awareness about HIV. So that's what we want with NCDs. Let's more have awareness, let's more have funds to tackle this disease. And with that, I'm sure even mental health cases will reduce, because the moment I'm diagnosed with cancer, I'll have mental health problems, because I'll be thinking about treatment, I'll be thinking about my finances, my family, you know. It brings another NCD on board. So as government, just let's have funds, let's protect our people, invest to protect.
All right, and I think that's a very good way to end it, that we need to really invest to protect, both from the government level, but even also from the individual level. To focus on learning about non-communicable diseases, understanding what they are, and also, helping in fighting the diseases.
True.
All right, thank you very much for coming on board. This was fun to do, and hopefully we'll be hosting you again soon.
Thank you so much.
All right.
Bye.
Now that was incredible. Thank you for listening in. Share this with your networks and follow us on all social media at Storylink and at NCD Champions. See you on the next one.